Web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, California, especially Southern California, the beautiful state of Southern California. Hey, we have got a great show for you today. I have been doing a neuropathy show in 8 states. Of course, California is our biggest state, and I have learned so much about neuropathy. I've learned how painful it is. I've learned about the numbness, losing your balance. There's so many things, but the most important thing I've learned is a lot of people don't even realize that what they're going through is neuropathy. We have the greatest expert when it comes to neuropathy. Let me introduce you from the Westside Wellness Center, Dr. Jason Kelberman. Good afternoon, Jason.
Hi there. Great to be back on the show.
Hey, I'm so glad we have got you. I never realized how important neuropathy is, and all the people that are suffering from it that don't even know that that's what they're suffering from.
Because sometimes the symptoms are so mild and even intermittent. And, you know, a lot of us go by the maybe it will go away motto, right? Yeah. So until it gets worse, we don't tend to do anything about it.
Tell people about your practice.
So, gosh, I'm in West Los Angeles. I've been in practice for 40 years and specializing in peripheral neuropathy and other foot-related nerve damage issues for the last 20 years. So much so that I realized that the foot rehabilitation world hasn't caught up with modern technology. And so I developed, patented, and are going to begin manufacturing the world's first foot rehabilitative equipment that we call Foot Power. And it's extraordinarily helpful to anybody who has a foot problem, nerve problem, diabetic problem, etc. It works for the whole foot. It not only restores the strength and movement to the foot, which obviously we want because we want better balance and we want to keep walking, but it also helps in increasing the circulation, which is usually one of the first things that starts the process of nerve degeneration with neuropathy. So go ahead and ask the question, Steve.
Well, tell people what neuropathy is.
Well, I think most of the people who are dialing in know that neuropathy is a generalized term for nerve damage. Yeah. When you use the term peripheral neuropathy, that means at the ends or the peripheral of our body, and usually hands and feet, where feet, it's 95% feet, 5% hands. And your next question is going to be, so why such a big uptake in neuropathy in the last 5 years or 10 years? And I'm going to answer that in 2 ways. First of all, we eat too much damn sugar, number one. Our food supply is not clean, so we're constantly eating things that don't belong in our body. And when COVID came along, the COVID virus, when it infected you, whether you had a minor case or a major case, or you got vaxxed and so you didn't get it or not, had a real affinity to uptick the diabetic world, as well as breast cancer. There's a huge upswing in the last 3-4 years in breast cancer. Just go to any of the cancer treatment centers in your area and ask them, and they'll tell you they're so busy they can't even keep up with it all. So what happens is we start to damage our blood vessels, and the big blood vessels, they get a little damage, but they have such diameter to them that then it's not going to stop the flow. But when you get down to the really small capillary beds in your feet, where there's just a couple of cells flowing through at a time, when they start to get congested and blocked, then all of a sudden that blood supply doesn't go to your nerves. Now your nerves don't get oxygen. Guess what happens? Right? Nothing good.
What?
You have degeneration based on no oxygen. Every living tissue needs oxygen. You got another question there, or I'm
Somebody
just going to
just wrote in. Yeah, somebody just wrote in wanting to know, does stress activate neuropathy?
Ooh, well, here's the answer is I'm going to give it a definite maybe. Stress doesn't help anything. Okay. If you're constantly stressed for a long period of time, that's going to raise the adrenal hormone cortisol. What that does, and some of us coffee drinkers like that, because caffeine also does that, which, by the way, I'm going to diverge just for a second, because if I give a diabetic black coffee without sugar and they run their sugar test, their sugar goes up. And everybody's first response is, but I didn't put any sugar in it. That shouldn't happen. That's the adrenal hormone cortisol, which is getting your body ready to fight or flight, is what we call it. Sympathetic and parasympathetic systems, those are two nervous systems. The sympathetic is the one that says, I'm going to fight you. I'm going to run. I'm going to jump. I'm going to save my daughter. All of that. That's all sympathetic. Okay. What that does is it jacks up your sugar. It gets you ready so that your muscles can perform. Okay. Has nothing to do with healing, wellness, or anything else. In fact, you cannot do much in the world of fighting inflammation when you're in that mode. And so what happens is the body tends to get inflamed. So now you got a lack of oxygen and inflammation going at the same time, and it starts to overload the system. The body can't keep up with that, and sometimes you can figure that out, and sometimes you need a doctor to figure it out for you. And so that's how stress can dovetail. It can also prohibit you from sleeping well, right? You know how important sleep is? Okay, here's an analogy.
Yeah.
Don't charge your phone for one day. What's going to happen? It's going to drop dead on you. Well, guess what? You don't sleep, you don't heal, you don't recharge, you don't recover. And the less you sleep, the worse it gets. And that's, unfortunately, we're humans. We still need sleep. I typically recommend 6 hours straight. All right. If you can get 6 hours straight, you're doing pretty good. If you're getting 1 to 2 hours and you're waking up with pain, or you're waking up because you have to go pee, you're not getting into deep REM sleep, and you're not getting all the healing that you need. So you're always going to feel deficient, whether you have enough energy during the day or not. Okay. The good news is, if you're an insomniac, man, you get a lot done because there's a couple extra hours in the day. But from a keeping your body healthy point of view, not so good. So that's my answer to, does stress bother the body? And I could relate that to any disease process or athletic endeavor.
Well, I'm going to tell you, I know you've had incredible success with treating neuropathy, and we've got other doctors around the country who are telling me how they're treating neuropathy. But why do we have so many doctors in the medical world say there's no treatment for neuropathy when that just isn't true?
Well, in their world, they don't have anything. You have to understand that medicine America is defensive medicine. What does that mean? That means if you step out of your box, if you do something that your local state board says you're not supposed to do, they can take your license away. So, and trust me, I'm in that boat too. In California, hey, I have a board too, and I have to stay within my guidelines. And so they have not developed anything beyond gabapentin and Lyrica that they are willing to say is a treatment protocol for that. There's one other thing that they do, and that's intravenous immunoglobulin therapy. Okay, that's actually the only thing that they have that actually treats neuropathy. The drugs are just hiding the symptoms of it. Okay, but no surprise, gabapentin and Lyrica, they only work on pain. They don't work on numbness. So any of you out there that you're numb and your doctor put you on that, you go, gee, this doesn't seem to be helping. You're right. It doesn't. Get off of it. Tell your doc. And so I fully understand their position. I get it. You know, they need incredible studies to justify anything that they do, or they're held legally liable. Yeah, I mean, I was part of a multi-doctor clinic for 15 years, and I saw all the ins and outs of every specialty and what they have to go through and what the parameters are. And yeah, I feel for everybody right now, because we're not allowed to take a patient from A to Z. We're only allowed to take them as far as our license will cover. Okay. And yeah, I'll tell you a little story about that too. We were going to open up a specialized clinic in the Cayman Islands, and we stopped by the cardiac hospital that an Indian doctor created, and it was fabulous. And he said to me, "How much do you think the malpractice would cost for the whole hospital and all the cardiac physicians?" And I went, $10 million. And he came back and said, 250,000. And I was like, my jaw dropped open. I went, how is that possible? And his answer was, because we're outside United States law. Okay.
Makes sense.
They don't have people suing them every day if something doesn't go right. Okay. And they were doing unbelievably fantastic surgeries over there, quadruple bypass surgeries with a nurse at the bedside and computerized systems for $40,000. Do you know what that costs here in America? $500,000 or more. Right. So this is the dilemma we're in America right now, where most of the doctors, they can only do what they're told they're allowed to do. And that's it's kind of arrogant in the way when you look around the world and you see what Germany and France and a lot of European countries are doing, and Switzerland. They're doing phenomenal, groundbreaking work. And it'll get to the U.S. in 10 or 20 years or so. But for right now, you'll just have to learn to live with it, according to the AMA. And that's not so. That's just not so. Do you know how many people we help? Do you know how many docs around the country are doing great work with these people? And so it's actually one of the reasons why we offer a free screening, just so that people don't have to feel obligated. They can come in, they can look at the research, they can look at the results, talk to the people, talk to the patients, get a proper diagnosis on how significant or insignificant it is. Because a lot of people, they think they have neuropathy and they don't. Okay, they've got a lumbar sciatica, or they've got a true mechanical foot problem, or there's a lot of different things that it could be. So it's important to get properly diagnosed. And I'm happy that I have the skill set to differentiate all of those things for people who pop in.
Well, Dr. Kupperman, you've got such a great approach. Why do you get better results in treating neuropathy than others do?
It's more complete. Okay, A to Z. So first of all, they don't have foot power. So I don't think I've ever visited a clinic that had certainly not any better foot rehabilitation than what we have anywhere in the country. Okay. So much so that I've got a podiatrist friend in Costa Mesa he's so crazy about what we did with foot power that he's probably going to be the face of foot power coming up soon. That's number one. Nobody has that. It's just overlooked. It's like, it boggled my mind why nobody came up with it. In fact, the podiatrist said to me, he said, I can't believe a chiropractor came up with something that the podiatry world should have made 25, 35 years ago. They're still using towels and marbles and try to pick this up. And that's BS. You don't walk on a towel or a marble. You got to train it like it's weight bearing. So it's an area that's completely overlooked. So that's number one. All right. Number two, I always dig as deep as I can into the metabolic component. Not everybody's diabetic. Some people have fatty livers. Some people have toxic syndromes. Some people have traumatic things. Some people have everything. I had a case last week. They have sciatic lumbar disc problems. Okay. They have diabetes. They've got fatty liver. They've got genetic foot problems. I mean, you name it. This guy had everything. Okay. And in order for me to get him any better, I basically have to do everything. That's the key for me, is whatever got you sick, that's what you have to treat. And sometimes it's all the foot and sometimes it's not.
I've read somewhere, I was going to do this last month on our show. I read somewhere that there's a lot of drugs that actually cause neuropathy.
True. So if you go on my website, westsidewellnesscenter.com/forms, there's a list of 68 drugs.
Oh my God.
Yeah, anybody can go there and download that. And sometimes these drugs cause it directly, and sometimes they cause it because they're depleting a vitamin or mineral from your system. And the most common one is metformin, which is probably the oldest and most used diabetic drug, and it depletes you totally of B12. B12 is essential for nerve function. The problem is, and if you go online, they're going to go, buy my B12. Okay. First of all, there's 3 different types of B12. Second of all, if you already have nerve damage, just replacing the B12 probably won't change anything. You still have to address the damage and how to restore function to that area. In the same way that statin drugs for cholesterol can cause neuropathy. And if you catch it really quick, I had a case in today. She said, when I started doing the statin drugs, I started getting numbness and tingling in my feet. I said, yeah, you're right. You need to go back to your doc and tell them it's not working. You got to stop that. But if you take it long enough, and a lot of people have been taking statin drugs for 10, 20, 30 years, the damage is done. Even if you pull them off you still got to deal with the damage. So each case is unique. I believe in my heart that that's really why we get better results, because we dig as close to the root cause of the situation as we can. And then, of course, you have to work with people, and they have to be willing to participate. Foot power, it only works if you do it, right? It's like, if I said to you, hey, I got an exercise program for you, okay, you're going to go from A to B in 4 weeks, but you don't do it, you're not going to get the results. So that's the most common question, when I sit down with a person trying to decide if we're a good fit. If they're willing to do the work, they're a good fit. If they're not, there's no magic pill. Okay. The medical world seems to want to have gabapentin and Lyrica as the magic pill. And for those that it helps with pain so they can sleep better, it's a godsend. No question about that. Okay. It does help people. But it doesn't change the condition or help the condition.
I read a lot about people falling in the bath and taking a shower. And now, after doing so many shows with you, because balance is one of the problems that people have with neuropathy, what if you don't take care of this?
It just gets worse. 10% of everybody over 60 falls and has a major injury. So keep that in mind. Also, that's just walking around falling. Okay, that we're not even talking about going up on a ladder or doing other things that require more balance than just walking. But pretty much everybody over 50 in my practice, I tell them to stay off ladders anyway, unless they're in good shape, because we don't bounce as well as we do when we're younger. And balance is real important. And as you get older, your bones may not be as strong. A lot of people have lower bone density, and a fall can be really, really bad. Some people, end up in the hospital. Some people actually die from embolisms from their fractures, etc. So falling when you're older is bad. Period. There's nothing good about it.
Yes.
And I'm glad to say that foot power gives people a lot more years of better balance walking. And I hope that by the end of next year, it's recognized as the standard of foot rehabilitation and what all aging people should be doing. And if you walk into any gym and you ask, hey, where's the foot strengthening equipment? They're going to give you a very funny look because there ain't none. Okay. And that's just the way it is. And I'm glad to say that, if I'm remembered for just one thing and they say, hey, Dr. Kelbman was the first to invent the foot powers. Great. I've helped tens of thousands of people with chronic pain, but if that's all I get known for, I'm okay with that. All right.
Yes.
It's going to help hundreds of thousands, if not millions of people here in the US. And then of course it's going to leak over the world. China will probably steal it and everybody else will have it after that. So that's kind of where it is.
Dr. Kelberman, the West Side Wellness Center is the name of your practice. Tell people how they can get a hold of you.
Well, they can go online at westsidewellnesscenter.com and get both our phone number, 310-268-8008, or I believe you can even just schedule a quick visit online, westsidewellnesscenter.com, or just call 310-268-8008. My favorite front desk manager is Maui, like the island. She's great. She knows all about this. We've been working together for quite a while. She can be very helpful for anybody to answer some quick questions and get them in. Yep.
Dr. Kelberman, we are so lucky to have you. You'll be back again with us next month. I want to just personally tell you, have a wonderful Thanksgiving. And thank you again. You have opened the eyes of so many people. We'll see you again next month.
Right. Glad to be here. Everybody out there, had a wonderful Thanksgiving with all your families. Enjoy.
I love Dr. Kelberman. Thank you so much. That's going to do it for us today. We'll be back again with you next week. Actually, we'll be doing a recording. We'll have a pre-recording because next Thursday is Thanksgiving. Thank you, Juan. Have a wonderful Thanksgiving, bro. We couldn't do it without you. We'll see you all in a couple weeks.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.